Now, yesterday on KTN Weekend Prime, we ran a story about antibiotics being used in animals and not being transferred to children and other people who eat chicken and pork, and how that's developing resistance within these people with respect to drugs, specifically antibiotics. And in studio this evening to keep that discussion going, because it is a serious problem. In fact, globally, it has been recognized as a serious problem. We have Dr. Lois Achieng Ombajo. She's an infectious disease specialist.
Yes.
Now, I think the best place to start is with the ease with which I can get perhaps any drug that I want, any antibiotic that I want. And what does it speak to with respect to regulations? Do we have a regulatory environment that says, no, you need a prescription? And is that being followed?
There is some regulation regarding the use of antibiotics, and antibiotics ideally should only be dispensed with a prescription. Ideally. Unfortunately, over time, we have a lot of chemists. I'm sure if you walk down any street, you'll probably see 10 or more chemists. And we also have people who are demanding antibiotics.
Yeah.
So with time, I think enforcing some of this regulation has become a little difficult.
Yeah.
And antibiotics are being dispensed without recognized clinicians' prescriptions, which is very sad.
All right. Now, the story that we're going to have in a moment from Dorcas Wangira speaks about the responsibility of people who take these drugs, right? You're prescribed for an antibiotic, whether it's prescribed or not, or you walk into a pharmacy and you don't complete your dose, and that builds up, of course, resistance to those specific drugs. But what does that speak to with respect, again, to the medical practitioners, to the doctors, to the pharmacists who prescribe perhaps second-line drugs for what could be a drug what could be a disease that's dealt with a first-line sort of treatment?
I think maybe to look at it, the fault is everybody's fault. First, many people who have no medical background will decide they want to take antibiotics. So for every cough, every diarrhea, every headache, they want an antibiotic.
Yeah.
But for you to get well, you need to treat the right bug that's affecting you, treat it with the right drug, and take the drug for the right duration of time. What we've seen over time is people are taking drugs that they don't need. They take them for a few days, and the minute they feel better, they stop taking the drugs, and that leads to the bacteria developing defenses against the antibiotics that we use. So with time, most of the antibiotics that we have as first line, as you said, may not be as effective for the bugs that were initially intended. Unfortunately, also, some medical practitioners may get into the habit of prescribing stronger, so to speak, stronger antibiotics than you actually need. And that also means that you start to select or choose, offer a conducive environment for some of these bugs to become resistant.
Yeah.
And with time, we'll get to a point where the easy-to-treat infections no longer respond to the commonly used antibiotics, and we have to use stronger and stronger antibiotics. The end result is that we only have a few antibiotics. So with time, we'll have no more antibiotics to use.
And this has happened with TB. It's happened also with some drugs that are used to treat HIV, malaria as well. But perhaps as a conspiracy theorist, you have to think about the medical benefit that is from the people who produce these medicines. A second-line drug, a third-line drug is more expensive to a person who's suffering, and therefore it would be more profitable to them. Is there that sort of an element that goes into this with respect to corruption around the prescription of drugs?
I think that may be partly true, especially with some of the failure we're seeing in enforcement of regulation. It means that antibiotics that ideally should only be used with a prescription of a doctor who is actually specialized in that area can be prescribed by anybody.
Yeah.
They can be bought over the counter, and we've had situations where someone buys an antibiotic that should be strictly regulated over the counter. Is there an element of profit? I think the more aggressively drug companies market, the more easier it is for people to access some of these drugs. So I think the issue should be controlling access to drugs, because if the access is truly controlled, then it doesn't matter how much you market it. Not everybody can access it. So I think the pharmaceutical industry has a role to play, but the regulatory bodies probably have a bigger role to play.
All right, you mentioned the sort of procedure that someone would have to go through when testing for the right drug that you need to take. You need to be able to go to the laboratory, you need to be able to specify specifically know what specific ailment I have and therefore use the right medicine for the right purpose. But with Kenya and with sub-Saharan Africa, that process can be expensive, prohibitively so for a majority of people. And that's why perhaps a lot of generic antibiotics are in use, and that's why we're developing this kind of resistance. How do we bring down the cost of, number one, drugs, and number two, the entire process of treatment and diagnosis?
So, very truly said, one of the biggest hurdles to getting the right diagnosis is a lab process. It's expensive, but not all hospitals or health facilities are equipped with a good lab or a good process that enables patients to follow through. So in terms of reducing the cost, one, we have access to a lot of generics. The concern sometimes is are the generics of good quality, and I think the Pharmacy and Poisons Board has a process of ensuring that some of the generics are of good quality, and I think it's up to them to make sure that every generic we get is of good quality, and to also work with the bigger pharmaceuticals to see whether the cost of drugs can actually be brought down. In terms of the lab process, I think over time the government is working to try and increase access to lab facilities, increase training of lab practitioners so that this can come down. Having said that, if you look at most of the infections that people treat with antibiotics, they're actually not caused by bacteria. So if you see a common cold, for example, or a cough that comes after cold, or most of the diarrheas that we see, they're probably caused by a virus and don't actually require
an
lab.
antibiotic.
And many times if you talk to a doctor, they'll be able to judge, does this patient actually seem to need an antibiotic or not? So it's always best to see a recognized health practitioner as opposed to just going and buying drugs for yourself.
All right, we've been speaking with respect to what's happening globally, but locally, do we have any statistics on what specific diseases are now becoming drug resistant and what we need to be able to look out for?
Yes, we have some data from many of the hospitals and some of the research institutions as well that are pointing to the fact that many of the common infections or common bugs that cause infections like pneumonia, infections like typhoid, infections like many of the common diarrheal diseases are beginning to become resistant to the simple antibiotics that we're using before. So, well, that means that we have to use stronger antibiotics. And as I said before, we only have so much in our armamentarium of strong antibiotics. At some point, we run out of those stronger antibiotics.
All right, but there is also a wider discussion, and then we're winding up here. There is a wider discussion with respect to the access to drugs that perhaps we should have mentioned at the beginning. It's not just for antibiotics. It could be for antidepressants. It could be for anything. What is the role, again, of those who are supposed to be enforcing it legally to ensure that the right kind of expertise, first of all, is used in prescribing the right drugs, and how do you enforce it when there is a multiplicity of pharmacies, like you mentioned, down the road, that I can get all sorts of drugs, including drugs as strong as antidepressants?
I think one of the areas that we've been very successful in is in controlling access to narcotics. So there's an act of parliament that actually controls access, and it's very clear, the monitoring process. What does a pharmacy have? Who has it dispensed to, on what prescription? I'm not sure that a similar act actually exists for the other drugs. And I think the onus falls on us to make sure that we create some of these processes so that things like antibiotics and other commonly used drugs are truly controlled. All right,
Dr. Lois Achieng-Ombajo, thank you very much for joining us this evening on KTN Weekend Prime. We will continue this discussion because obviously in terms of public health, it is an important discussion to have.